जो दांत हैं वो नेचुरल occlusion जो है वो when teeth erupt, they are not in balanced occlusion. Means not in balanced occlusion means all the teeth are not touching simultaneously and pressure is not distributed evenly. तो जब 12, 15, 18 तक जब सब when all the teeth erupt, they occlude, but they are in a hit slide occlusion. That is not an imbalanced occlusion. And as we age, everyone, the natural teeth wear off and they break because they are not in a balanced occlusion. They may be aligned properly but may not be balanced. So there is a different concept of alignment and balancing. It's just like a car alignment and wheel alignment and balancing. Balancing is totally different, alignment is totally different. Aligning companies do alignment, balancing is not done in that. Balancing is a different concept. Teeth where the wear and tear is more when teeth are not balanced. If you balance the occlusion, then teeth will reduce. The wear and tear will be very less. No root canals required, hardly any root canal required, hardly any implant will be required. Or teeth or the cap and crowns will not break. But normal occlusion, the teeth are not in balanced occlusion. Means all the teeth do not touch simultaneously and there is no canine guidance. Canine guidance means when the canines, the lower canines usually hold the jaw, and when there is a lateral movement and sideways movement and front movement, protrusive movement, lateral movement and protrusive movement, the interferences are more. Means जब हम साइड में मूव करते हैं तो पोस्टीरियर कैनाइन टच करता है and the molars and the premolars do not touch on both sides. There should be some space. Only canine should touch. Can you see the canine touching? There is a space here and there is a space here. So these spaces on lateral movement, there should be space so that teeth do not have a lot of pressure. Same on the left side. When the teeth slide on the left, jaw slide on the left side, the canine disoccludes, means only canine touch and the rest of them do not touch on both sides. This is known as God. This is done by God, and this is a God-given gifted thing wherein the load is divided and the canine holds the jaw. Similarly, when the jaw slides in front, only the front teeth touch and the posterior teeth disocclude. Means there's a space here. So the protrusive and lateral movement, teeth are there is no interference. So when there is no interference, there is less wear and tear of teeth, and if there is less wear and tear of teeth, there is less load on the TMJ and the surrounding structures. TMJ is temporomandibular joint just in front of ear, which moves when the lower jaw moves, because lower jaw is mobile, upper jaw is fixed. So whenever lower jaw moves up and down, sideways, the TM joint and associated muscles and the structures, if it is in balanced occlusion, they will be at rest. If it is imbalanced occlusion, they will be understrained and they cause trouble like extraoral symptoms. Some people have clicking joints, some people have popping joints, some people feel difficulty in opening, closing, some people have locked jaw, some people get early morning headaches or pain on both sides, some people get migraine attacks, some people get ear or ringing ear or sound in ear, जैसे बोलते हैं कान में सीटी बज रही है, some people get जैसे हवा लग रही है कान में, so some difficult and some people have blocked ear. They are all because the muscles in the vicinity of TM joint, temporomandibular joint, where are in continuously strained position. So some people have difficulty muscles. Some people have clenching habits. Some people have a night grinding habit, and it can be anything, any combination. And some people rarely have pain here or here, and some people have difficulty combing here. So extraoral symptoms are related to bite imbalance, which people do not know about it. Almost 40 to 50% of the population in the world suffer with extra oral symptoms, and they are not diagnosed on time, or they are never diagnosed. They live with it. They go to doctors to find go to ENT, neurologist, psychologist to find the pain, but never. So you have to go to an occlusion specialist who does balancing, not alignment. Alignment is not balancing. So, and some people live with it, and some people have intraoral signs and symptoms like one tooth will become sensitive, one will break, one will wear, teeth edges will break down, the gums will recede, then some teeth becomes oversensitive. One eat from one side, then they go for root canal, they go for crowns, the crowns break, the root canal tooth breaks. So different kind of intraoral signs and symptoms related to bite imbalance one can read on Google. So there are extraoral signs and symptoms, and intraoral signs and symptoms related to bite imbalance. So one thing is that when the teeth erupt, they are not in a balanced occlusion. They may be perfectly aligned, but they are not in balanced occlusion. So if you if they are not in balanced occlusion, means they will wear and the tear will be more, means breakage will be more. With age they wear off. So we have been working on prevention. So we know that prevention is better than cure. So at what age it is diagnosed and what age it is treated, that will decide the lifelong the longevity of teeth. So in case you want to save the teeth for life, we have to balance them as early as possible. Now what options we have? As now this person, one case scenario, there will be 2-3 cases only. If you as the teeth erupt, you go to the if it is diagnosed, that time the balancing is done, then the wear and tear will be less. If you, because some people don't have extraoral symptoms, they don't go to doctors. They go to doctor only when they have extraoral symptoms or intraoral signs and symptoms. So how can we detect? If we get a scan done at early age between 15 to 25, we can just detect the imbalance. In this case, if I'll show you this scenario, if you see the teeth, some teeth are touching and some teeth are not. So now the jaw patient, the person is 19 years, he won't have trouble, there won't be any bone tooth. So if you come early, you will not find any bone tooth. Now I'll show you. So at this age, there are 3 scenarios. One scenario is where early, in this case, not a single tooth is worn, but that is not a balanced occlusion. So in this scenario, we tell the patient we can balance the occlusion by simply alignment, because teeth are not worn. So there will be 3 case scenarios. One wherein patient presents without, so non-worn teeth can be only balanced, or it may require alignment and balancing. If they are not aligned properly, for cosmetic purpose we can align them and balance them. So when teeth are not worn, we can balance them. So you have to remember, the alignment is only for teeth which are not worn. In this case, if you see, not a single tooth is worn. All teeth not worn means the cusp, the line, you can see the lines. The cusp tips are intact. Incisor is not broken. So that means, so in early condition, if you balance them, the teeth will not wear and tear faster. So we can just balance them in alignment in case required. Okay, now, so we can detect this is current occlusion, and if you want to balance them, we have to bring it to the occlusion to where this is the level of balancing the occlusion. That means we have to see the difference between current occlusion and where the occlusion should be. Balanced occlusion means the joint, TM joint, the condyle has to be at rest, which is in the most posterior part of superior and most posterior part of the condyle fossa, gland fossa, wherein the TM joint will be at rest, so that there is no extra stress on anyone. But if the teeth are not balanced, they go to imbalanced occlusion and one side is tilted, and then they start feeling some symptoms. Some people are symptomatic, some people are completely asymptomatic. There can be multiple combination of things which are listed in the link below. If you click the link and keep on filling the link, you will come to know that your jaw is imbalanced, but signs and symptoms may be different, may differ from person to person. Now, in case I want to balance this patient as early as 19-20 years, no teeth are worn, I will just do alignment and balancing and equilibration. Equilibration is I will distribute the pressure. So in this case scenario, this is a current occlusion. I've taken a scan, I've done a bite with bite analysis. I decide that this is the place where the jaw should be. In case this is the one, this is a current occlusion, but this is imbalanced. So at this, I will just take, I need to balance it here. So it may require only some alignment, and I will just distribute the pressure, that is equilibration, and it is balanced. So teeth will not wear and tear. Now I'll show you next case scenario wherein patient comes little late. Patient comes little at after maybe if the because it is not necessary that people go for prevention. They go only when they have trouble. So next stage comes in. If person doesn't reach that stage, go and at that age, the next stage takes over. So in this case, if I show you, the patient comes with lot with current occlusion, the patient comes with one broken tooth. So in this case, the patient has multiple bone teeth. See, I will show you that the teeth are bone. You can see this bone inside the indentation. Some teeth are bone from here, and one of them is root canal and crown. He got the root canal done, but didn't know that this is imbalance occlusion. So you see multiple bone teeth, and some teeth are not bone. So he's in the middle stage, maybe around 25 to 35. This is in the middle stage because jaw is imbalanced, had gone into hit and slide. Some teeth broke, some teeth did bone. So in this scenario, we have second option open of treatment, wherein in this case we cannot simply do alignment, because alignment, as I told you, was done only for non-bone teeth. Simple alignment procedure should not be done for bone teeth. Whenever you see a scan, if you see any bone teeth, then this is not the case for alignment. Remember, aligner companies do alignment, but that causes further imbalance. So whenever if you see, this is a bone tooth, this is a bone tip, so this is a bone cusp, canine tip is bone. Now this, if I align it, even if I align it, because this is bone, even if I align it, it is imbalanced because I have to stop it. So I have to go for restorative alignment, means I have to align some teeth and restore some teeth. I cannot align completely the teeth which are bone. I have to do restorative alignment in this case, means some teeth alignment, some teeth restoration. So this is a restorative alignment case. In this case, the patient may have symptoms, may not have some extraoral symptoms, only has intraoral signs. Teeth break, teeth keep on, they become sensitive, we cannot eat from one side, maybe multiple intraoral signs and symptoms, and may not be, maybe completely asymptomatic, or maybe severe symptomatic, we don't know. Extraoral, some people have severe headache, severe pain, migraine, so we don't know. But at this stage, when teeth are partially bone, or some teeth are bone, some teeth are not bone, we have second option open for restorative alignment. In this restorative alignment, we check the bite imbalance. In this case, we have checked the bite imbalance. This is a current state. This is the bite imbalance checked. That means this much bite has to be corrected to bring it to balance occlusion. Now in this case, these teeth are not bone. These teeth are not bone. These teeth are not. This is bone. So I have to build it. But in this, I don't. I have to build a little bit here. So in this case, I will do alignment of these, 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 and restorative alignment of the teeth which are bone. I have to build them. If I just do simply alignment, which normally alignment company does, that causes imbalance occlusion, because alignment does not consider balancing. We have to, that has to be carefully monitored, assessed, and then do restorative balancing. Like this, in case you see this, the canine tip is bone. Even if I align it, it will be in a bone state aligned. It will cause further imbalance, because the pressure cannot be distributed. Once the teeth are bone, the forces are unequally distributed, and the other tooth will break. So it goes into hit and slide. So it has to be restorative alignment. So in this second case scenario, wherein now if you see this, I'll show you what happens. Even if I align here, the upper portion of this tooth is bone. So I have to rebuild that area, keep a place for anterior guidance. Canine tips have to be made, and those, as I mentioned, canine guidance has to be created. Canine guidance means you have to restore the kick. So aligner company hardly consider canine guidance, and even if they consider, it cannot be done in bone state. It can be done in early stage when no teeth are bone. So alignment should be done for teeth which are not bone. That has to be considered. It is for general public information that if your teeth are bone, you are not made. The treatment is not alignment. It has to be restorative alignment, and you have to find a dentist who does restorative alignment, because aligner company any big companies, they just do simple alignment, and that causes further imbalance and future all troubles of, if you see and go to see the historical record of patients who have got alignment treatment done, they will have all at least 50% of them suffer with extraoral symptoms related to bite imbalance. Those are clicking joint, TMJ pain, migraine, headache, tinnitus, block ear, buzzing ear, and difficulty opening, difficulty combing hair, my vertigo, difficulty eating, so pain while eating, clenching, night grinding, these kind of problems, or any other combination, because those are not balanced, those are only simply aligned. So you have to be very careful when we do alignment by simple aligners, because you have to consider that whether they are in a worn state or non-worn state or partially worn state. So non-worn state can be aligned, partially worn state has to be restorative aligned, and restorative alignment is very complex process, simple alignment cannot do it. So this is the case of restorative alignment. And next, even if you don't go at this stage, you go at a stage wherein some people come later, that is when teeth are bone, maximum teeth are bone. But this is also current state. Current occlusion patient will come at this stage, may have extraoral symptoms, may not have extraoral symptoms, we don't know. Some people have it, some people don't have it. Some people only the teeth wear off, break, but they don't have extraoral symptoms, they are lucky. But some people have a lot of extraoral symptoms. In this case, if you see, almost, I'll show you, almost okay, I'll show you. So if you see multiple teeth bone, this is all dental exposed, all canine gone, all incisor is gone. So multiple teeth are bone. You see all yellow means no enamel. So in this case, can I do alignment? No, absolutely no. I cannot do alignment. Even if I do alignment, they will keep on wearing, because once enamel gone, they will wear off faster and the slide will be more. What I mean by slide will be more means, when the teeth wear off, one canine wears off from side, the lock system goes off, and the gauze jaw goes into hip slide. That moves like this. Normal movement is locked because the jaw, the occlusal locks are there. But when some teeth wear off, the locks wear off and there is no canine guidance, and there is all interference. In the old one I showed you that when the canine moves, when the jaw moves inside, there's a canine guidance, means the posterior teeth will not touch both sides. But when the canine guidance goes off, the slide becomes more and they wear and tear. They keep on wearing. One tooth breaks, you get a root canal done. Second tooth breaks, you get a root canal done. So you have to stop this wear by just simply creating an occlusal lock. Occlusal lock will create, but you have to consider this is a very complex treatment. For detail of the treatment I can explain later, but simple occlusal lock, canine guidance has to be done to prevent further wear and tear. Now in this case, if this is bone, you cannot do simple alignment. I'll show you the upper one. The person comes at 43 years of age, and for one tooth which is painful. This you can see here how much it is bone. How much it is, such an extent, bone here. It's an indentation. This has become so thin, came for root canal, it's about to break. So multiple, now at this time, intraoral signs and symptoms come into picture. The person comes with, these teeth are wearing, he cannot eat food, he cannot take cold water, the teeth, when he eats something like a watermelon, it hurts. So they become sweet, sensitive, because enamel is gone. So in this, I'll show you the lower. You can see how much bone. There is nothing, there is no canine. There is no canine tip. The canine tip should have been there. The edges are not there. But they have bone. Now we don't know how much they have bone. So what we do, we have to balance the occlusion by creating the occlusal locks. So we have to see how much it is imbalance. Now in this case, we saw this much of imbalance. Now once it is imbalance is checked, then we have to correct by rebuilding them. Now in this scenario, so many aligner companies I've seen, they will align them, but they have not restored it. So they will go to further imbalance. Now in this case scenario, we have to restore them. If it is bone from up, we have to restore on top, and if it is bone from down, now it has to be restored in microns and millimeters without doing a single root canal. We can just rebuild them. So So we have to check the imbalance. It can be hip slide collapse, it can be hip slide tilt, it can be hip slide push, and sometimes teeth break. Now in this case we have completed the treatment by simply rebuilding them. You can see that we have completed without doing a single root canal. We have finished it by rebuilding them. So rebuilding is, so we see if the teeth are worn, we cannot do alignment. If they are partially worn, there has to be restorative alignment. If they are non-worn, there has to be alignment and balancing. But balancing by equilibration has to be done in every stage. So I'll show you another case. This was maximum, but now I'll show you one more case wherein some teeth are worn, some teeth are not. In that case, it was quite severe. This is a less severe form. So in this case, the person comes like this. May have extraoral symptoms, may not have extraoral symptoms, we don't know. Because that below link, when you click, then you will come to know how much imbalance and how many extraoral symptoms you have. That is immaterial, but treatment remains same. Whether you have extraoral symptoms or you don't have extraoral symptoms, whether you have intraoral signs, the treatment remains same for balancing occlusion. It has to be checked with initial scan how many teeth are worn. If teeth are not worn, then you plan it. So scan is must. So that is the initial assessment. In this case, the person comes here. These are worn. We finish it with this. But we finish it with this. Now I'll show you here. Can you see? Can I align it? No, I cannot. But when people don't know, the information is not there to general public. They get trapped with aligner companies, and to the extent that they do alignment for these cases also. So if you get alignment done, they open the bite, they do alignment, and they further go into imbalance. So we have to do restorative balancing in this case. No alignment option. In this case, we have, now if you see the teeth, we have built them by combination of ceramic and combination of composite, but not a single tooth root canal. I'll show you the lower. Now lower teeth, it came with this. With this, can you see? These are all bone teeth. Okay, if you see from inside, now, no, there is no need of doing root canal. You have to just rebuild that. But when it is more bone, I can put a ceramic veneer or crown, and the less bone means I can just put a composite rebuild. So not a single tooth. So we are balance specialists, and we just do balancing by rebuilding them. So whatever is gone, we will rebuild it without doing a single root canal. If you see, these are balanced with composite. But here is ceramic. So depending upon where pressure is more, is a combination of ceramic and combination of composite. We can rebuild them. Now, and these red spots means we have equilibrated the pressure, distributed the pressure. Wherever the pressure has to be there, if the teeth, now this is a balanced occlusion. So whenever balanced occlusion means when we have restored them, we have to reduce the slide, hit and slide. And when they close, they should close. All of them will close together, so they don't break. They don't slide. They don't break. So ultimate aim is to reduce the hit and slide and rebuild them. So in this scenario, you can see this. This is pre. This is pre. I'll show you. This is pre. This is post. Rebuild. So again in concise, I'll tell you, when teeth are not worn, early age 15 to 20, 22, non-worn teeth, non-symptomatic, symptomatic, that is different. That the dentist will decide. But when teeth are not worn, only alignment. But balancing has to be done. Ask your aligner company whether they are giving you balanced occlusion or not. Balanced occlusion means canine guided, lateral protrusive movement checked. Simple alignment will further imbalance it. So it has to be canine guided, lateral protrusive movement has to be checked, and pressure has to be distributed. Means whichever, if the tips have to take the pressure, then tips have to take the pressure, and the cusp tip fossa relationship There are many occlusal dynamics which you can go through online. That occlusal parameters are taken care while finishing the alignment treatment. If you don't do that, it will be in a balanced state, and it will be hit and slide will be more, and breakage will be more. So alignment without you can do simple alignment by braces and aligners, and you can do alignment by alignment plus balancing. Now if you are doing if some dentist is working only on balanced occlusion, then alignment is a part of it. But all alignment in alignment state, those who are doing only alignment, the balancing is not a part of it. So you have to ensure that whether the dentist is capable or dentist knows about balancing. So if they don't tell you about balancing, then ask them that are you giving me a balanced occlusion or just giving me simple alignment for cosmetic purpose? Because if you are giving for cosmetic purpose, they will just align and give it to you. Okay. So balancing is different than alignment. In this case, alignment is the option first. Second case scenario, the teeth are partially bone. In this case, also alignment. Many people do alignment, but bone teeth cannot be aligned. Remember, so partially bone, some teeth can be aligned, some teeth have to be. So it's a case of restorative alignment and balancing. Balancing is a part of it. Okay.
Unknown comment.
Okay. And third case scenario where some teeth are more bone, but it has to be restorative alignment. Now alignment by braces or aligners out of this question. We cannot open the bite. We have to restore that because teeth are bone. So in this case we have done restorative alignment, restorative balancing, not alignment. Okay, and where in a next state where there come almost 70 to 80% teeth are bone. You can see the bite imbalance. You can see this bite imbalance. Okay, so it can now it has to be a restorative case. So in this case we have checked the imbalance level and we have restored. This was the imbalance level and we have restored this with balancing. Okay, so if you see, this is restored. Now original is this, final is this, but not a single tooth root canal except for one which the patient had pain. Okay, and imbalance level checked and we finished. So case scenario very simple. First, current occlusion, checking the occlusion, how much imbalance has to be taken care, and then correcting the occlusion. Second scenario, current level, imbalance level checked. This is the imbalance level. I have to refill the space and then finish this patient. Finish, I will show you later. Okay, but it has to be restorative. It takes some longer time. And third scenario, I have explained to you. Now it is up to you, and also you must know that if you get a 3D scan of your jaw, upper and lower jaw, you yourself can decide whether you are a case of alignment, restorative alignment or restorative. If teeth are showing signs of occlusal damages, which are mentioned in the link below, that means first fifth, the numbers which are there from first to 43, anyone who has 16 onwards till around 40 number, they are in a imbalanced state. They cannot go for simple alignment, so they have to go for they should check the scan. If the teeth are showing breakages, bone, crowns, they should go for balancing the occlusion. And first 15 are extraoral symptoms related to bite imbalance. So if you go on taking the questions on the numbers, the first 15, if you have symptoms related to bite imbalance, it may show as extraoral symptoms. Don't get confused. Extraoral symptom may be there, may not be there, but intraoral signs usually are there in mid-age onwards. Young age, you may not have intraoral signs and symptoms. They can be only extraoral signs. So how one will know? The person in general public information is get a 3D scan, see the scan yourself, and see if the teeth are bone. If the teeth are bone, no alignment. It has to be restored or restorative alignment. If they are completely bone, you will know that the aligner, the companies cannot fool you, because you will end up. And if you have extraoral symptoms, forget about simple alignment. It has to be in a balanced occlusion, because TMJ will cause a lot of trouble. TMJ is this. This is the movement of jaw. This one when pulls, then this one when pulls. then it hurts. So this is a general information to general public. So I hope I am able to give you a general information so that people do not get misguided by big companies who are only doing simple alignment.